All right, guys. Thought we would try something a little different. So, I'm going to answer some questions that I've been getting, some on the channel, some on my website. We'll see how this works. I don't really know what I'm doing here, so you'll learn with me. Get your coffee. All right, so just remember, this is not medical advice for you. Talk to your doctor. Find out what's going on. If there's a problem with the sound or something, let me know. We'll try to adjust what we can. I know I need a better microphone, or maybe I should say a microphone, but it is what it is. So, all right. Had a patient come in the other day, and he wanted to know if it was okay to try, a certain diet, and particularly he was wanting to try the keto diet. And I've had several patients try that lately, and one patient is losing a ton of weight with this diet. Now, tapering is BS. All right, I'm going to get to that. All right. So, let's see if I can figure this out. Hold on. Okay. All right. So, anyway, this patient of mine is trying the keto diet, man. He's losing weight like crazy, and it's working well. I do have a few caveats if you're going to try something like an extreme diet. Fat loss, right? Nutrition. Okay. So, if you're trying to weigh whether or not you can eat, a bag of pork rinds versus a couple apples, and your diet says that the pork rinds are better, I've got a problem with that. So, just keep that in mind. All right, I got someone commenting that tapering is BS. Taper down to 0.8 a day. Was sick for 6 weeks. Didn't sleep 5 weeks. Literally, I don't know how to get this to stay on. I can't read it quick enough. Literally had to go inpatient. Okay, so I still don't understand. So how quickly did you taper? Are you still there? Anyway, tapering is tricky. Everybody's a little different. You've got to go, most people have to go really slow and really low. So over 2 years, you were tapering, and did you jump off at 0.8 milligrams? Anyway, so I've got patients on 0.5 milligrams, taking it every other day, and sometimes they do that for months. So, everybody's a little different. I've had other people jump off at 1 milligram, and they did okay. You know what I mean? So, and I've had people like you say, man, they were just horribly sick on a really low dose. So that's tough. Well, I got to figure this out. So 32 milligrams a day to 0, yeah. And you did that over 2 years. Oh, I'm sorry. That's Brock. Sorry, man. You can tell I'm a newbie at this, man. I don't know all this technical stuff. So low and slow has been what my patients have found success with. But again, so you went inpatient. I'm hoping that worked out and you're doing well. Sometimes depending on how long you were on opiates before, might make the taper even slower, or how long you need to be on Suboxone. There are some people who prefer to get on Suboxone just quickly, a week or two, just to manage the immediate withdrawal and taper quickly. But most of my patients are maintenance patients. So what we do is we get them clean from opiates. We work on the psychological issues. We work on the depression, the anxiety. We work on the bad habits. We work on anything that would be impediment to their recovery. We work on what's important: relationships, right? Their job, just being happy, being healthy. We give them time to focus on that, and then when they're ready, we start a taper, and it's typically slow. Now, a lot of doctors do things differently. All right, so can Suboxone affect a woman's drive? Yeah, so any type of opiate, whether it's a full agonist or partial agonist, can affect hormone levels, metabolism, things like that. So, I'm assuming you mean sex drive. Yes, it's easier to tell in men, right? But it can affect women as well. Same type of processes are going on as far as hormones and things. So opiates will do the same thing, and so sometimes the Suboxone gets blamed. It could be that there were problems from opiate use, pills, heroin, etc. But anyway, sorry, I meant to put my phone on block, so I'm getting text messages from my friends. But anyway, it can. Now, what's the treatment for that if you're a woman? Well, the first thing is you need to get to your doctor, get your labs checked, see if there's anything going on that can be adjusted as far as, make sure your thyroid's working well, check your hormone levels, etc. See if there's anything that needs to be done medically, okay? Make sure you're exercising. And you're going to hear me say this over and over. Make sure you're exercising. You want to be pumping blood, nutrients to your body. You need to be eating healthy foods. If you're eating junk food, it's going to mess you up, guys. If you're overweight, your hormones are going to be out of whack. So you need to be exercising. You need to be eating real food, healthy food, preferably apples over pork rinds. But I'm not, dissing the diet because, like I said, I've had patients get amazing results from some of these type extreme diets. But you just got to be healthy with it. Healthy, okay? What else? Again, and I've said this, so with the person just asked, guys, get your testosterone checked. All right? Very important. What else is the exercise, the diet, all that? What else is it going to do other than just making you feel good? Man, it's helping to stimulate your own natural dopamine response, okay? And those things have gotten kind of jacked up, right? Being on medicine, and so you need to start to get your the natural mechanisms working again, so that you can have good dopamine response. Okay. What else? Okay. All right, so let's go back to, let me find this comment. All right, so someone, they went to the doctor, they were off opiates, they're off Suboxone, and the doctor's recommending Suboxone because of their depression. So now, obviously, I cannot tell this patient if that's a good decision or not. Okay, I don't know because I don't know enough about their history, etc. In my opinion, that would kind of be an off-label use, right? Because if the patient is saying they don't have any cravings and they're not worried about relapse, I would be nervous putting someone on a medication like that for depression because it is so addictive. You can become dependent, have withdrawal, all the same problems everybody else is having trying to stop the medicine, right? So I would be leery about doing that. But at the same time, I think the reason is because they're trying to treat post-acute withdrawal syndrome, okay? Because the patient is depressed and fatigued and having a lot of issues. That may be why the doctor is recommending it. But I would do it knowing exactly, what you're getting into. Okay? All right. So your own pain medication and you're wanting to try to stop pain meds like without taking Suboxone, hold on, my son just walked in. Hey, buddy. All right. So you would take some of the same. You would do it kind of in the same way. You would just go in slow over time. So the first thing is you might want to try to, if you're on long acting and short acting, just slowly taper down the long acting, and then slowly taper off the short acting. But I know that's kind of general. That's not real specific. Let's say you're on 10 milligrams of hydrocodone, you can go down to 7.5s, et cetera, et cetera. But there's other ways you can, the doctor might want to change the timing, frequency, and things like that. Okay, but let's talk about this. Let's say you're on a medication and you're on pain meds and you're just wanting to see, hey, I want to get off these, see if I still have pain off of them. Because, a lot of the pain that if you're on chronic pain meds and when it's time for your next dose, you're hurting, right? But some of that could be withdrawal, okay? Even though you're hurting more than you normally hurt, like if you have chronic low back pain or whatever, okay? So, if you want to get off these meds, and let's say you're going to have withdrawal for a week, and this is the same with Suboxone too, because this answers another question I had. Somebody wanted to know if they could use tramadol to taper off Suboxone. Well, and tramadol is like a short-acting opiate, okay? I wouldn't. What I would do is go low and slow on whatever medicine you have, taper slowly, get to low doses, and then when you decide to jump off, realize you might have some withdrawal, get your doctor to write you some clonidine or something like that that'll kind of blunt some of the effects. The new medicine Lucimira might be, if you have insurance, might be a good choice. If you don't have insurance, it's very expensive, but so I know, not very specific, but just talk to your doctor. I think, and you can always just tell your doctor, look, you're worried about having pain, but you're not sure, if the medicine's working or not working, etc. You just want to try it off. So you don't have to, what's up, buddy? You don't have to, just because you decide you want to try to stop, if you have a good open conversation with your doctor, it doesn't mean, you're never going to be able to be treated again, okay? No, Xanax and Ambien is not the same thing. So Xanax is a benzodiazepine, typically used for anxiety, but can be used for sleep. Ambien is just a sleep medicine. Ambien does have some dependence issues, meaning like you can get where the only way you can sleep is if you take Ambien, right? But it doesn't typically have the same effects as something like Xanax, where you have to take more and more of it over time, or become like addicted, where you have like severe withdrawal from it, okay? You don't think he looks like me? What's up, buddy? All right. What else we got? Nothing?
Yeah. Can we work out again, Daddy?
Huh?
Can we work out again?
My wife says it's a recessive gene. You don't think I should believe her?
I'm not a girl. I'm a boy.
You're-
We're drinking coffee.
All right. What else, guys? All right. So, trying to think. I had some other stuff I was going to talk about.
I'm crazy.
I'm reading through some of the comments. All right. So, how can you lose weight?
Wait.
How much do you want to lose? Well, here's the first thing. You got to exercise, and you've got to eat healthy. And there's no way around it, okay? There's lots of hacks. but you need to eat real food. So the thing is, it's very intuitive. You know if something's okay to eat. Don't get caught up, at least not right now. Don't get caught up in how much protein, how much fat, how much carbs, how many calories. Just eat the right kinds of food, okay? And you know what the right foods are. The right foods are stuff that's basically grown, that can be grown in your backyard, okay? Or shot in the woods behind your house. Those are the right foods, all right? So if you can do that, and you can eat that way, look, just try eating that way 9 out of 10 meals and see what happens. Try, if you're eating like once or twice a day, 3 times a day, split it up. Split it up into 5 or 6 meals. Okay, to keep from getting too hungry. So eat every 2 to 3 hours. And with good, healthy, food, clean food, and just see what happens. Now, if you're already eating 6 meals a day and you just can't lose weight, one way to do it is just start eating the exact same foods every day. So now this isn't necessarily my preferred way, and then you can cut down the calories from there. But I would prefer you not to worry so much about the calories, proteins, fats, carbs, and just eat real natural foods and go from there. All right. So also exercise, man. 30 minutes a day. Get 30 minutes a day before you do anything. Walking.
Yeah.
And then 3 days a week, do strength exercises. If you don't want to go to the gym, do push-ups, sit-ups, air squats. All right. Get where you're doing 100 reps of each of those 3 times a week. All right. Do that and walk every day for 30 minutes and eat nothing but real food, 9 out of 10 meals, and see what happens. All right. My thoughts on long-term, lifelong replacement treatment. Yeah, I just posted a video about that. There are people who are going to need medicine lifelong, long-term. And the thing is, I know a lot of people start thinking, hey, I'm going to be one of these, on it for life. I don't want you thinking that way. I think it's better just to think, hey, I'm on it right now. And I'm going to stay on it right now. And who knows what tomorrow will bring, okay? Because you don't know. You don't know how you're going to be feeling. And this is what I see in my practice the most. I'll have people who are dead set. They're like, I'm never stopping this medicine. Like, I do not want to relapse. And everything's going good. My job's working well. My relationships are good. I got money in the bank. I'm not stopping meds. But sorry, he's cracking me. But then one day, and so we'll treat them for a few years. And then all of a sudden they come in, I'm ready. And that's what I like to hear, because I like people to be self-aware. You know what I mean? And to not limit yourself. Give yourself options. Give yourself the option of maybe stopping it one day, but knowing right now that you don't need to. Hold on one second. My son's doing something dangerous. Aiden, come on, buddy. Get down. Get down. You're making me nervous, man. I don't want you to fall. All right. So yeah, but some people are going to need lifelong therapy, and that's what I talked about. If you were on pain pills for 50 years, and all of a sudden now you're on Suboxone, your pain's controlled, you're doing all right. Why taper? I mean, there may be a reason to taper, but why would we hate on that person who says, no, I'm good? So, a lot of the chronic pain folks are going to need on it. But let's say you somehow, how did I become bald? I'll tell you. All right, so somehow, you were on heroin for like 10 years and you survived it. And now you're on Suboxone for the first 2 years. But your life is so different, You're probably not going to want to taper right now. Eventually you might, though. So, never say never. All right. Would I suggest Suboxone over tapering down pain meds? It just depends. Just depends. All right. The thing is, Suboxone helps with pain as well. And I think it's the future of treating chronic pain because, hold on one second. Aiden, get down, buddy. just because it has a ceiling effect. You don't have to continue to take more and more doses to get the same effect. So you know how much pain relief it's going to give you when you're on it and on a stable dose. If you have chronic pain, I got to tell you, and you already know this, right? You're not going to be without pain. There's nothing that's going to completely take your pain away. Okay. So it might be worth a shot. If you're feeling stuck, like your pain's not controlled, but you can't stop pain meds. I mean, that's why a lot of people get on Suboxone in the first place, because they have chronic pain issues and they found themselves not being able to stop their pain meds, and they were still hurting. I had a lot of folks that I transitioned who were, they were on like a few Percocet a day. They get a prescription, but every month the doctor would give them a prescription and they would start taking more and more and more. Okay. So, all right. How long have I? 10 years. I've been in private practice for 10 years. Yes, I am a full-time doctor. I take Fridays off. Plus, it's a rain day here in Mississippi. Yeah, all the schools are closed. So, I'm thinking about maybe trying this live thing on Fridays. We'll see how it goes. I don't like having a set schedule, though, because then it would start to feel like work. What else we got? Tell your friend to come on over. What else? So, all right. Any other questions?
Yeah. Yeah, Daddy.
So, they're saying hey to you, Aiden. Somebody said hey.
Hey.
All right. So, that's right. He's working. Put him to work.
Okay.
All right.
I'm gonna go get a hamper.
Yeah. So, all right. So, again, I don't know about you, your case, why you're on it, or anything. All I know is term treatment. So that's why I say don't put yourself in a box. You feel like you can't kick it. Maybe just give yourself some more time, right? There's no, you're not going to get a gold medal for who tapers off Suboxone the quickest, right? There's no prize at the end. I mean, other than just your own, I guess whatever, if you set that goal for yourself, you know what I mean? But you're not racing against other people or whatever. Just for my patients, I like for them just to take their time, to go slow, and if they need to just hold off on a dose for a while, who cares, right? Like, look, all right, I've got a diabetic patient, and he is losing weight like crazy, right? And his blood sugar is looking great, all right? We're probably going to be able to reduce his diabetic meds, okay? Ooh, watch out, man. That'll hurt you. All right. But let's say we start to lower his diabetic meds, and then all of a sudden he hits a plateau in his weight, and we can't lower him anymore. What am I going to do? Am I going to say, nah, I'm going to force you to keep tapering off your diabetic medicine? No. I'm going to keep him on it, keep him safe, healthy. You know what I mean? So that's the thing, man. Like, your goal is not tapering off Suboxone. Your goal is staying happy, staying healthy, working on your relationships. Those are your goals, right? Now, tapering off Suboxone might be a part of that, or it may be that you just need to stay on the meds and work on those things for a while, right? So it's not a competition as far as that goes, okay?
They just don't want to work, so I just want to work.
All right, methadone versus Suboxone. I personally only use Suboxone. Methadone works for some people. I think to me, Suboxone is a little safer and cleaner, less mental fog, and I just think it's a better medication. So, Hey, that's awesome. Your brother's 8 years clean. That's great. What if you can't take Suboxone? Do you mean like do you mean like it makes you nauseate or gives you headaches or something like that? Well, anyway, I'll tell you. So I've had patients who had trouble with Suboxone, and we simply tried them on Subutex, which is just plain buprenorphine. Typically, they do okay. There are some people, some of the time, who do better with just plain buprenorphine than Suboxone, and there are some people who just can't tolerate Suboxone. So if you're trying to taper off opiates or kick a heroin addiction, whatever, and you cannot I have a hard time, if you're on those other stronger stuff, surely you can try tolerate buprenorphine, but some people can't. So maybe methadone would be an option. Maybe you just need to try some of these others where you, not you in general, talk to your doctor, but maybe you just need to taper down on whatever you're on and have some withdrawal, but take like Lucimira to blunt the withdrawal effects or something like that, okay? There's other forms of buprenorphine other than just Suboxone. Hold on one second. Aiden, get down, buddy. We're on like the second floor. There's these boxes. It just makes me nervous. All right, good. So, what were we saying?
You messed up.
Yeah, I forgot what I was talking about. All right, so there's other forms to tolerate better, like Sublocades and injection. But those are options. All right, now someone asked about Butrans. So Butrans, basically the active, medicine we're talking about when we talk about Suboxone. And Butrans is approved for chronic pain treatment. Now, it's a lot lower dose than straight Suboxone Subutex. So the dosing's a little different. But yeah, Butrans I think is a good option for people with chronic pain issues who maybe have developed also some dependence, okay? And remember what I said earlier, I think buprenorphine is the future of treatment for chronic pain. I can't predict the future, but that's highly possible. So, all right. Zubsolv is equivalent to Suboxone. So that's interesting. See, Zubsolv, I've had some people say the same thing. It's supposed to be a little stronger, right?
Ew.
And I've had some of the same people say
That's disgusting.
they just didn't like it. Didn't feel like it was working well for them. So that's interesting that you asked that. But I don't know. All I can tell you is it's supposed to be just as good.